of you who are joining us from Asia, and if you happen to join us from the Americas, good morning to you. We have half an hour of webinar on the PicoWay Resolve handpiece, followed by 15 minutes of question and answers. So I would encourage you to reserve typing the questions until the end of the webinar, where I will be able to then address these questions. I would also like to inform you that this webinar will be recorded. Therefore, you will be able to have access to it at a later date at any time that you want. So we'll start with our webinar, and would like to just give a brief introduction on the picosecond lasers and its technology. Those of you who are not familiar with this technology, this is a fairly recent technology that was introduced for the first time 7 years ago in 2012, which has largely substituted and has taken over the nanosecond technology, which we were familiar with for many years. The key difference is in the short pulse duration. So when we are moving from the Q-switch lasers to the picosecond lasers, we are going from the nanosecond to the picosecond domain. And as you can see on the right bottom of the screen, 1 nanosecond equals 1000 picosecond. And that extreme short pulse duration gives us the benefit to be able to use more of a photoacoustic or a photomechanical effect at the cost of photothermal effect. So one of the key differences between the nano and the picosecond is that we are able to produce less heat, but more mechanical effect. And this is exactly what we would like to see when we are treating tattoos or pigmentation. However, having said that, the picosecond technology, although has transformed, revolutionized the way we will treat tattoos, is now being used in other conditions as well. Just like with the nanosecond technology that is also used in pigmentation, one of the key things is the fractional handpiece that is available in the picosecond technology. And that is what I'm going to be concentrating today in this webinar. The PicoWay system from Candela has 3 wavelengths: the 532 nanometer wavelength, the 1064 nanometer wavelength, and this unique to Candela wavelength, the 785. The 785 should not be confused with the Alexandrite 755, because this 785 nanometer is generated through a titanium sapphire. The Candela PicoWay system also has the highest peak power from the picosecond technologies that are available in the markets. And what that means, it allows us to have sufficient fluence, sufficient energy in a large spot size. And there are certain scenarios where we would like to prefer using a large spot size, particularly, for example, when treating darker skin types, when we would like to protect the epidermis and have most of the impact on the dermis. As you can see, perhaps the most important feature of the PicoWay system lies in its extreme short pulse duration. All 3 wavelengths of the PicoWay system have pulse durations below 500 picoseconds. So let's pause here for a second. If we know that 1000 picosecond equals 1 nanosecond, and we have transformed our practice from the nanosecond technology into the picosecond technology, that means when we are having long pulse duration in the picosecond domain, such as 800 or 900 picoseconds, although we are in the picosecond territory, we are very close to 1 nanosecond, which makes it more of a hybrid between a pico and a nano. Translating that into clinical practice, that means we are still going to have to rely on certain amount of heat, which is the photothermal effect that we will call, at the expense of the photomechanical effect. Whereas what we see here, where all 3 pulse durations of the PicoWay system are below 500 picoseconds, this allows us to have a pure predominance of photoacoustic effect with less effect in terms of the photothermal. And this is extremely useful because that is the key point of transitioning and transforming from the nano to the pico, is that we would want an extremely short pulse duration, and therefore we rely less on heat and more on photoacoustic effects. And this table perhaps summarizes some of the differentiating factors and features of the PicoWay Candela system from the other Pico systems that are available. And I would like you to pay attention to the pulse duration, where you can clearly see that the pulse duration of the Candela PicoWay system is the shortest in the market. And with that extreme short pulse duration, we are once again able to have pure photoacoustic effects with less photothermal effects. There are other favorable features, and in particular, the fact that we have two wavelengths in our fractional handpiece, and also the ability to have a large spot size. So the PicoWay system from Candela comes with these two handpieces that you see. The upper one, which is what we describe or call the zoom handpiece, and the image on the lower part, which is what we will call the resolve handpiece. The zoom handpiece is the traditional non-fractional handpiece, which is used for tattoos and pigmentation, and also a procedure that we refer to as picotoning, which is essentially the use of the 1064 nanometer Nd:YAG wavelength at low fluencies, utilizing large spot sizes from 6 millimeter and above at high frequency with multiple passes. A procedure that is particularly common in Asia, and it's particularly used in the management of melasma, albeit in combination with the resolve handpiece, as you will see later on in the webinar. But my focus for today will be the fractional handpiece, which is what you can see at the bottom of the slide, which has the term resolve handpiece. This is one of the key other differentiating factors between the picosecond and the nanosecond, in addition to the extreme short pulse duration, is the ability to have these fractional handpieces in the picosecond domain. The resolve fractional handpiece is used for pigmentation, rejuvenation, and, as you will see, in the management of acne scarring. Think about it as any other fractional handpiece that you would use with any other fractional technology. So if you are treating, or if you are used to treat, for example, acne scars with non-ablative fractional laser, then you can think of using the fractional handpiece of the PicoWay resolve handpiece to treat acne scars. So it's a similar principle. So if we talk about fractional lasers and fractional technology, where we understand and know that the light, the incoming light, is being fractionated into columns of light, and depending on the tissue interaction between the light and the skin, you either have ablation, where tissue is removed, and for that we have the fractional ablative CO2, such as the core intima system from Candela. However, if the fractionated beams of light do not cause any ablation, where we simply just get a non-ablative effect, then we refer to that as fractional non-ablative. The resolve fractional handpiece of the PicoWay is a unique form of non-ablative fractional technology, but in addition it is non-thermal. So if you think of the infrared non-ablative fractional lasers, such as the 1550 nanometer that we have in the ellipse system of Candela, that one relies on heat. Therefore, although it is fractional, and although it is non-ablative, but it is thermal. However, the resolve handpiece, it is fractional and is non-ablative, but does not rely on heat, and therefore it's non-thermal. So how can it be fractional non-ablative, but non-thermal? I think this is the key advancement in the fractional technology and the fractional handpieces of the picoseconds. And you will see in a few slides how this works. Unlike the zoom handpiece, which covers all three wavelengths of the PicoWay, the resolve fractional handpiece of the PicoWay comes in the two wavelengths of 532 and 1064 nanometer. Therefore, the 785 nanometer is only available in the zoom handpiece. The resolve fractional handpiece of the PicoWay comes in a standard spot size, which is a square 6 by 6 millimeter spot size, which you can see an illustration of it here on the image. The 6 by 6 millimeter standard spot size for both wavelength in the fractional handpiece resolve consists of 100 beams of light in 10 rows. These beams of light, which are generated through this extreme short pulse duration, generate pressure waves in the tissue. These pressure waves will have an effect on the skin. So I would like to just try and explain it easy. Anytime the light hits the skin, there is always going to be some form of interaction. Sometimes the light might simply pass through, the light might be reflected, but often in medical lasers, what happens is there is absorption. There is an interaction between that light and what we will call the chromophore or the target in the skin. The fractional handpiece, the PicoWay resolve, because of the way the light is being fractionated and with the extreme short pulse duration, this creates bubbles, pressure waves within the skin, and these bubbles we now understand what they are called, and we refer to them as light-induced optical breakdown. And these bubbles are produced because of the way this light is being fractionated, where you can see on the left side of the screen, you can see a hologram. That is the holographic beam splitter. So the light that comes out of the machine will have to be split in a way. It has to be fractionated through a certain technology. And this holographic beam splitter, which we refer to as the hologram, is a patent that is unique to Candela. And this is what makes this fractional handpiece of the picosecond technology unique to the other fractional picosecond handpieces that are available in the market, because of the way the beam of the light is being fractionated through the hologram, which is the holographic beam splitter, that is giving us exactly the same amounts of energy in each spot, without wastage of the energy, without creating any shadows. And this is extremely important because we will not have hotspots and we will be able to have the uniform amount of energy at extreme short pulse durations. So remember, the way the light is being fractionated is important too in the handpiece, and with the PicoWay resolve handpiece, that is achieved through the holographic beam splitter that we refer to as the hologram. Once the resolve fractional handpiece is used on the skin, this is what happens. This is what we see in histology. This is a term that is known, which is light-induced optical breakdown, which is essentially the result of the light interaction and the creation of these pressure waves. These pressure waves do not have any heat. Remember, this is a non-thermal fractional non-ablative. However, this forms an expansion of plasma, cold plasma expansion that is happening in the skin, and these bubbles and vacuoles that you can see are what we refer to as light-induced optical breakdown. This happens predominantly in the epidermis. However, when we are using the longer wavelength, the 1064, we also notice that we get cavitational effects and micro injuries in the dermis. So what we understand now is that with the 532, we get these bubbles predominantly in the epidermis. With the 1064, we get the mixture of the bubbles in the epidermis, but predominantly microscopic injury at the dermal level. And this microscopic injury at the dermal level that you can see here is what we refer to as cavitational effect. This cavitational effect is a consequence of the shock wave, of the pressure wave. The pressure wave that is generated through the extreme short pulse duration and the fractional handpiece is creating these bubbles, the vacuoles in the epidermis that we refer to as the light-induced optical breakdown. But the propagation of this shock wave, particularly with the longer wavelength, the 1064 handpiece, is creating these cavitational effects in the dermis that we now refer to as light-induced cavitation. So I want to clarify and simplify matters. We have in the PicoWay resolve, we have two handpieces. We have the 532 PicoWay resolve fractional handpiece and the 1064 PicoWay resolve handpiece. The 532 resolve handpiece is now predominantly used for epidermal treatments, so predominantly epidermal pigmentation, where more impact is required superficially, and the 1064 PicoWay resolve handpiece is used more for dermal remodeling. So that is what we use predominantly for rejuvenation or the management of scars and acne scars, and also used in combination with the picotoning method for melasma. So why is that important? Why is it important that we get these vacuoles, or what we refer to as these light-induced optical breakdowns? What clinical significance do these bubbles or vacuoles have? This is how I'd like to keep it simple and just try and give you 3 C's. So the first C is cytokine release. We know that the generation of these light-induced optical breakdowns through this pressure wave creates cytokine release. The second C is for cell signaling, and the third C is for changes in gene expression, which means that when these pressure waves hit the skin, and then we create these bubbles of light-induced optical breakdown, due to the combined effect of cytokine release, cell signaling, changes in the gene expression, we are getting favorable collagen remodeling. So it is a form of controlled wounding of the skin, a microscopic controlled wounding of the skin that will trigger these pathways of wound repair, and the eventual outcome of this wound healing pathway is neocollagenesis and better improvements in the skin that's observed. Also, some studies using in vivo microscopy and optical coherent tomography looking exactly at what's happening with these LIOBs. We understand that the LIOBs in terms of size and number are different related to the wavelength. So we know that the LIOBs are larger and more numerous with the 532 nanometer wavelength, and that has to do with the fact that the 532 is more absorbed by melanin, and melanin remains the first primary target for absorbing these the incoming light, and therefore it is the one that generates these LIOBs, whereas the melanin absorption with the 1064 is less. Hence, the LIOBs are smaller and less numerous, but because of the depth of the wavelength and the propagation of the pressure waves, we get the cavitational effect more in the dermis. What was also interesting to observe is that at microscopic level, there is still low-level exfoliation of the epidermis, something that we call the epidermal necrotic debris, for up to 4 weeks. And I think this is important because this highlights the fact that the interval between treatments when the fractional resolve handpiece is being used remains 4 weeks, because up to 4 weeks there was histological evidence of epidermal injury that's being repaired. So the interval, the minimum interval for the resolve fractional handpiece remains 4 weeks. Now, this is very exciting, and this is very new, and this was presented very recently at the Candela Academy meeting. This is work done by a colleague of mine in St. Petersburg, Russia, Professor Arabiskaya, and I was also involved in this study, which we are now publishing. What this study essentially showed is the difference between low fluence at the 1064 resolve handpiece versus high fluence. So two fluences were chosen, the low fluence, which was 1.1, and the high fluence 2.1. And at 2 hours, there were more changes seen in the epidermis with the higher fluence compared to the lower fluence, with no disruption of the stratum corneum. But if you look at 3 weeks, where biopsies were then taken after 3 weeks, again, at high fluence level, there were more changes in the epidermis. And if you look at the dermal changes at 3 weeks and compare the low fluence versus the high fluence, again, there were more changes in terms of the collagen effect and disruption there compared to the low fluence. So to simplify this, the conclusion from this study from our colleagues in Russia is that the high fluence 1064 resolve handpiece gives us more injury, gives us more microscopic injury that is still observed after 3 weeks, both at epidermal and dermal level. And this is what we see in clinical practice, that for more dermal remodeling, for example, in the management of acne scarring, we require really higher fluences. So we understand now that with the 1064 resolve handpiece, higher fluences do give us better results. And that has now been proven histologically. So when do we use the resolve fractional handpiece? We can certainly use that for pigmentation, again, in combination with the zoom handpiece, the non-fractional handpiece. We can use that in scarring. And acne scarring is a popular one. And of course, we can use that also in rejuvenation. These are the images from Dr. Eric Bernstein in Philadelphia, in the United States, when the PicoWay was going through the initial study using the combination of the 532-1064 fractional handpiece, which has led to this paper in the Journal of Lasers in Surgery and Medicine, describing the fractional handpiece of the resolve with both wavelengths, the 532 and the 1064. So this is a patient of mine who is dark skin, so the pathology is in the dermis. That's why I would want to have most of my impact in the dermis, and therefore I'll be using 1064 resolve handpiece. I have observed through my experience that using higher fluences gives me better results with acne scarring, and as I showed you now with histology, that has been backed up with histology. Another patient of mine who is dark skin, who will be at risk of post-inflammatory hyperpigmentation if I would use the fractional CO2. And here in this patient series, again, of the 1064 resolve fractional handpiece, because my target is in the dermis, and therefore I will be using the 1064 nanometer resolve fractional handpiece. The treatment will be with high fluences, so that is higher than 1.7, with multiple passes, a minimum of 4 passes. And something that I have observed clinically is on the areas of atrophic scars, where the scars, where I would want to have more impact on the scars, I do, in addition to the 4 passes, I will do some stacking. So I will do 4 passes, 2 vertical, 2 horizontal, and on some of the areas with the maximum scarring, in addition, I will do some stacking too. Another example, although this patient has fair skin and she would be a suitable candidate for fractional ablative laser, she did not want the downtime, and therefore she would be more suitable for non-ablative technologies, and the fractional handpiece of the resolve was a very suitable one here. And again, because my target is in the dermis, the 1064 resolve handpiece was used. Here on the chin, you can see an example of an atrophic scar. There is some vascularity, and again, this would lend itself to the use of the 1064 resolve handpiece. And I'm trying to see if the video, I'm unable to start the video here, but you can see the improvement, and this is just after 2 sessions with the fractional handpiece 1064, but I can expect more improvement if I continue using a few more sessions. This is an example of a hyperpigmented scar on the knee that was the fractional handpiece, and in this case I combined the 1064 plus the 532 resolved handpiece, and I got not just improvements in the hyperpigmentation, but also improvements in the scar itself and the textural scar. Another example of a scar on the breast with both elements of hyperpigmentation and improvements in the scarring using the combination of the 1064 and the 532, and the 532 was used because of the brown pigmentation elements. This is a paper that was published in Journal of Cosmetic and Laser Therapy using the combination of the 532 and the 1064 in rejuvenation by Michael Gold, and another study in rejuvenation with the combination of the 532 1064 handpiece. Recently, a comparative split 3A study was performed with the fractional handpiece of the 532 1064 combination versus the 1565 nanometer non-ablative fractional laser, and there was no difference. So the take-home message really is that the fractional handpiece of the PicoWay Resolve can also be used in striae with as much efficacy as the fractional non-ablative. This was one of my early patients treated with the fractional Resolve handpiece in melasma using the 1064 Resolve handpiece, followed by the picotoning, which is the 1064 zoom handpiece, large spots, low fluence, multiple passes. And another example here, treatments would be first with the Resolve fractional handpiece, and you can see 1064 there, followed by the zoom. This would be the large spot size, so 6 or 8 millimeter spot, low fluence, high frequency, and the results can be nice, although I must stress that this would require more than a single session, and in my experience would require the combination treatments, and I do like to maintain the results with non-hydroquinone creams, topical vitamin C, and high factor sun protection, and I always do pre-treat. Another example using the fractional Resolve handpiece, in this case 2 sessions, and another example of the Resolve fractional handpiece in the management of melasma in combination with topicals. So this is my approach, which is really important to pre-treat. I do not treat without pre-treatments, and I pre-treat for a minimum of 4 weeks. The key wavelength is the Resolve fractional handpiece 1064, but in lighter skin types with clear epidermal melasma, I have now started adding Resolve 532. I then finish that off with picotoning, and cooling afterwards is really important. Remember, as long as you use the Resolve handpiece, the interval will have to be 4 weeks. And this is one of the papers that has now been published using the Resolve 1064 fractional handpiece in the management of melasma. And as I mentioned, I pre-treat. And why is it important to pre-treat? Again, because of this publication that has clearly shown that when you pre-treat, you get better synergistic effects with less risk of rebounds of the melasma and hyperpigmentation. I also like to combine the 532 Resolve handpiece for any pigmentation, as you can see here, followed by the zoom handpiece. And again, in this case, because my target here is in the epidermis, once again, I'll be using the 532 Resolve handpiece, followed by the zoom. And for this complex or field epidermal pigmentation, I like to start with the Resolve, followed by the zoom. If the skin type is dark, then the end point is just subtle darkening with very light frosting and not too much white frosting, as that could potentially lead to post-inflammatory hyperpigmentation. Another example, and here my target is predominantly in the epidermis for the pigmentation, So I'll be choosing the 532 Resolve handpiece, followed by the Zoom for individual lentigos. However, if I wanted overall rejuvenation and improvements of the skin quality, of course I can combine that with the 1064 Resolve handpiece as well. And you can combine with fillers or other treatments appropriately. This is again a Cafe au lait macule with very nice improvement after only 2 treatments, and now the patient has requested further treatment behind the hairline. And again, this is epidermal pigmentation, and therefore I combined the 532 Resolve handpiece followed by the Zoom handpiece. And in my experience, the combination gives you better results. A case of ochronosis, which is due to prolonged use of hydroquinone, that was treated with a combined 1064-532 fractional handpiece, and we published this work. This was work that I did with my Mexican colleague when I was in Mexico. A case of argyria that was also treated with the Resolve handpiece. And this is my settings, and I will leave that on the screen for a minute. And feel free to take a photo of this, and I have shared this with the Candela team. And essentially what you can see is, if you look at the section of acne scarring or rejuvenation, the fluences tend to be high. And that is again my personal experience. Once again, these settings are my settings, and I will take responsibility for them. However, from my experience in the management of acne scarring and rejuvenation, in general, higher fluences are required, and this was backed up by the recent histology that I showed you. This has brought us exactly at 30 minutes to the end on time, and therefore, in conclusion, the Resolve handpiece is a fractional handpiece. It is fractional, non-ablative, non-thermal, that comes in 2 different wavelengths. The 532 fractional handpiece is what I use for epidermal remodeling, so predominantly epidermal pigmentation, and the 1064 for dermal remodeling. As you saw, we'll use that in scars, acne scars, and also in melasma. And the fractional handpiece now has become very popular, given it's a quick lunchtime procedure. It doesn't take more than 15-20 minutes with very minimal downtime, and I often combine that with the Zoom handpiece, particularly for pigmentary disorders and in the management of melasma. So I'd like to thank you all for listening, and we have now time for questions and answers, and I would welcome your questions. Okay, so I'm getting a few questions. So some of them are petition, but the question is, if you combine both wavelengths, the 532 and the 1064, does it matter with which wavelength you start? It's a good question. I'd like to start with the 1064 wavelength first. So anytime that I'm using both wavelengths with the Resolve handpiece, I like to use the 1064 Resolve handpiece first, followed by the 532 Resolve handpiece. And if I am combining the Resolve handpiece with the Zoom handpiece, I like to start first with the Resolve handpiece and follow it up with the Zoom handpiece. There is a question on the pre-treatment. Now, the pre-treatment, that depends, of course, on the doctor's preference. I do not like to use hydroquinone as a pre-treatment, so I do avoid that. So my pre-treatment is a high-factor sunblock, and I prefer the physical sunblocks, together with a vitamin C serum, because they have synergistic effect when they're combined. And I like non-hydroquinone based creams that contain kojic acid and arbutin. I like to typically pre-treat for at least 4 weeks. However, if the patient has a history of post-inflammatory hyperpigmentation or is more prone to post-inflammatory hyperpigmentation, then a minimum of 6 to 8 weeks. But I like, once again, to use a high factor sunblock, which is a physical sunblock, together with high concentration vitamin C serum and a non-hydroquinone based lightening cream, one that contains kojic acid or arbutin. There's a question on which skin types you can treat. You can treat all skin types from skin type 1 to skin type 6. And with skin type 6, again, it's safe to use the 1064 Resolve handpiece with no concerns. I do not use the 532 Resolve handpiece in skin types 5 and 6. I tend to limit the use of the 532 Resolve handpiece up to skin type 4, but the 1064 Resolve handpiece I have used across all skin types. There's a question on, well, do you always combine treatment? Not necessarily. So in the management of acne scars, for example, I only use the 1064 Resolve handpiece. I do not necessarily find the addition of the 532 Resolve handpiece that's going to alter the outcome. That's my experience. So I do not. In the management of melasma, I do like the combination of the Resolve and the picotoning. So in these cases, I do combine. There's a question on what about 532 Resolve alone? Again, I discussed this during the webinar. That's when my target is epidermal. So if I'm dealing with cafe au lait macule or epidermal pigmentation like numerous solar lentigos, in that case, I would only use the 532 Resolve because I see little benefit of adding the 1064 Resolve. So in very simple terms, if the target is dermal, I use the 1064 Resolve handpiece. If the target is epidermal, I use the 532 Resolve handpiece. If my target is in both, then I would use both handpieces. There's a question about isotretinoin. Well, recently, as you know, there have been numerous publications on the fact that there is little evidence to back up any particular concerns on the risk of scarring, treating whilst on isotretinoin or soon afterwards. However, I would say refer to your local guidelines because in every country the practice is different, also in terms of the insurance. But from the scientific point of view, there is no concern if the patient who is on isotretinoin is being treated. However, the advice from Candela company would be not to treat. There's a question, what about hyperpigmentation burn on skin type 4? Then in that case, that would be treated. If it's purely just hyperpigmentation and not an actual scar, then that would be treated as post-inflammatory hyperpigmentation, which would be with the fractional 1064 Resolve handpiece and the Zoom 1064 handpiece. I would like to use the 5mm spots at fluences around 1.2 to 1.4 with low hertz and to do 1 or maximum 2 passes with cooling. If this is a burn and it's a scar, then I will treat it as a scar, which would be with the 1064 fractional handpiece for scar remodeling. And if there is a pigmentation issue, then I will also combine that with 532 Resolve. So once again, in this case, it depends if it's a scar and pigmentation. And for the scar components, it will be the 1064, and for the pigmentation components, it will be the 532. If it's just purely a burn scar and the scar tissue is the issue, then I'll just use the 1064. If it's predominantly just purely the pigmentation, then I'll treat that again as post-inflammatory hyperpigmentation. There's a question on what is the typical downtime for acne scarring treatment. That, again, depends on the settings that you will use, but in general is just 1 to 2 days of some swelling and redness, but most patients by day 3 are absolutely fine. There's a question, is the combination between Resolve and Zoom handpiece necessary in the treatment of melasma? I would say not essential. I think melasma is a condition that is difficult, we all know, and there are different protocols. What I would like to highlight is the evidence based on the published paper on the use of the Resolve handpiece. So when it comes to the level of evidence, there is evidence on the use of the Resolve handpiece in melasma. There is also evidence, lots of evidence on the use of picotoning, laser toning, using the ND-YAG wavelength in melasma. And this is the rationale for the combination, is the combination of the laser toning and the Resolve. But you can choose to choose the modality that you would want. The only one thing I would mention is that with the repeated picotoning used at shorter intervals, there is a concern of hypopigmentation, something that we have not observed using the Resolve 1064 fractional handpiece. Therefore, from the safety point of view, the Resolve 1064 handpiece is very safe. But this is my practice, and you perhaps would like to start first with the 1064 Resolve handpiece in combination with topical treatments, and then can consider adding the picotoning at a later date in case the response is poor. I'm just going through the questions because some of them are just simple repetition that we have addressed, such as pretreatment, skin types. Once again, all skin types up to 6, but the 1064 Resolve is up to skin type 6. 532 Resolve I would not use in the very high skin types 5 and 6. Downtime we discussed. We still have 2 minutes for any last minute question. Otherwise, I would like to thank you all for listening to this webinar. And once again, this will be recorded and you'll be able to access it at a later date. Thank you very much.